I would like to hear from Tearsanee about this patient trust piece, particularly from the perspective of communities of color where that trust in the healthcare system has traditionally been fairly eroded. And, with the pandemic, if anything, that erosion worsened. So how can health systems that are standing up these remote patient monitoring programs go about gaining trust from communities where that trust is low to begin with?
I think it begins with where that patient's first contact, is.
Mhm.
So for us, we do have to have a provider's order, in order to start remote patient monitoring. I think it's very important that they hear from their provider. I think Eric mentioned it, as well. It's very important that they hear from their provider that the provider believes, that this is a good thing,
Mhm.
for them. And also, not only that the provider believes that, but that the provider uses it too. And what I mean by that is that when they're coming in for their appointments, that the provider is talking about it. That they're saying, "Hey, have you been doing your sessions?" And all of that. But even aside from that, we have found that it works better too if we partner with organizations, and not just the individual providers. We do the individual providers, but for example, let us partner with the groups that are tasked with taking care of them. So, for example, the federally qualified health centers, the rural health clinics,
Mhm.
the people in their community that they know,
Right.
and so so that we have some boots on the ground,
Mhm.
that are talking about this and that are engaging with these patients, and that can inform us,
Mhm.
about what's going on with those patients. The other thing is the training, and not just the clinical training, but the training of how to interact with people. You know,
Mhm.
um, I like being frank. I can't help it, but I've had some instances where nurses were uncomfortable with particular topics, or they've said to me, like I've said, we need to be asking them this. I can remember when we first started talking about the social determinants of health, and some of the nurses were like, "Well, do you think they would be comfortable, with us asking these questions?" And I said, "I
Mhm.
need to evaluate whether that's about you, whether
Mhm.
you are uncomfortable, with asking that question. Because if I'm having a problem with water, I'm probably hoping, with clean drinking water, I'm probably wishing that someone would ask
Mhm.
me so I don't have to volunteer that information.
Mhm.
So just everybody who is coming in contact with these patients, or these people, should I say, being very sensitive about their own personal biases, and making sure that they're not imposing those things onto the patients, the people we're coming in contact with. But I will say, having those community relationships, not thinking that we have to do it all. I can tell you, we're the big UMMC in Mississippi. So many patients are comfortable with their own provider, in their own community. And what we like to say is we're an extension of them
Mhm.
coming in and
Mhm.
taking over. We're similar to home health. You write an
Right.
order for home health comes in, and they do what they're supposed to do, but they're always in constant communication, with the prescribing provider. And that's the way, we operate as well. But I do think it starts with each individual evaluating themselves and assessing themselves for how they feel and their level of comfort, because it does, rub off. The patients do feel that, and they do see that.
Absolutely, absolutely. And I also think the other point you made is very important, where it's sometimes gaining that patient trust is just about empowering the people that they already trust and, so helping support them.